Yes, I know. Oh, okay. Well, we'll stick to the definite.
We have a couple tiny chairs and stuff.
So anyway,
So it means like that's actually easier to work. I mean, but you never know. I don't know. I'm sure there's an element. You don't know what you don't know.
David, when are you passing out samples?
Yeah, exactly.
Pay for the breakfast and the samples.
Under your seat.
Okay, since Dr. Altman is not here today, so I have to introduce our speaker, Dr. David Naimi, and talking about cannabis. And the word of the day will be bronchodilation.
Well, how is that related to cannabis? We'll talk about. Yeah, a few days, I wasn't scheduled to give this talk, as you guys know, and a few days ago, Len Altman called me for a favor, and when Len Altman calls you for a favor, it's like the mob, you can't say no. so he asked if I had a presentation, and I did. I had a part of a presentation ready. No disclosures, relevant disclosures, by the way. Hopefully you guys didn't attend this, because otherwise some of it will be a repeat of what you've already seen, but this was at the college meeting. Myself, Rohit Katyal from National Jewish, and Hannah Brucker, who's a retired allergist from Minnesota, did a talk on and a panel discussion on what the allergist needs to know about marijuana, medical and recreational. And I primarily was involved with the introduction to cannabis, and I added to this talk we're going to touch on some respiratory effects of cannabis and general effects of cannabis, as well as allergic sensitization to cannabis. I gave this talk, if you guys recall, a few years back now. I think it's been 40 years or so. And a few things have changed, but not a whole lot. So here's what we'll be talking about. We'll kind of discuss cannabis and its legalization, ways cannabis is used, patient perceptions and patterns of use, the effects of cannabis on the lungs especially, and then briefly allergy to cannabis. So as you all know, cannabis is most well known for its use as a recreational drug because of THC, which is a cannabinoid and a psychoactive compound. And the plant itself is processed to produce various products. So you have herbal cannabis or marijuana, which is the dried leaves and flowers and stems and seeds. Hashish, which is a pressed dry resin. There's something called hash oil, sticky black liquid, and then there's things like shatter wax and pubic hash oil, which we'll touch on. And when it comes to herbal cannabis or marijuana, that's the most common product used in North America. Hashish, most common product in Europe. Historically, cannabis really goes back quite earlier to 2700 BC, where it had a certain variety of roles, from textiles to medicinal, and used for a variety of medical indications. And its medical use spread from Europe to the Americas much later in the 1800s. And there's actually a lot of articles when you look from Merck and Bristol-Myers Squibb, Eli Lilly, talking about tincture of cannabis as a medicinal product. And there was a decline in its use, and eventually, in 1941, was removed from the American Pharmacopoeia. Cannabis contains a lot of stuff. That's one thing we need to remember here. So over 400 compounds and well over 60 cannabinoids, including the most well-known is THC, but there's CBN. We've heard of CBD or CBD oil. That's kind of like the hot thing now. Whether there's good data on its efficacy, I would honestly have to look into. But I think a lot of studies need to be done on these cannabinoids to see what their effects are. And I think that's underscored by this article from Contemporary Pediatrics. I quoted the author, and she states that while there are potential cannabinoid compounds in marijuana that might have therapeutic potential as individual pharmaceutical products, marijuana itself is not a medication and should not be considered as such. And so you hear a lot of folks, a lot of patients or friends or members, maybe family members who are using some sort of oil, or maybe they're smoking weed at night because it helps them sleep, because it has the CBD in it is helpful for me. Well, it's a shotgun approach if you're doing that, right? So if you're inhaling this stuff, fair enough, but we have to remember that we're also inhaling various other things. And each of them could indeed have possible therapeutic potential, but it needs to be there's already 4 FDA-approved medical cannabinoid products, 3 of which are synthetic. So there's synthetic THC, which is Marinol, another synthetic THC, Sesimet, and another synthetic THC called Syndros. A lot of these are used for anorexia and human-induced nausea and vomiting. And if you guys were paying attention to the news in this past summer, the FDA approved its first drug ever directly purified from cannabis, and that's from a CBD oral solution. And you look at this kind of the disclaimer is kind of echoing what that Contemporary Pediatrics article mentioned. The FDA commissioner stated that this is an important medical advance, but it's also important to note that it is not an approval of marijuana or all of its components. So, of course, I think this needs to be studied more as far as its components. And this is just for your reference. We won't go over each one of them. These are some medical cannabis drugs currently in development. So let's talk about the current state of cannabis legalization. As you guys recall, our state and Colorado legalized marijuana for recreational use in 2012. And soon after, a couple years later, Oregon, Alaska, and Washington, D.C. followed suit. And then in 2016, California, Massachusetts, Nevada, and Maine, and Vermont also followed kind of shortly after that. And at this point, 9 states plus the District of Columbia now allow recreational marijuana use. But we have to keep in mind that marijuana still, of course, remains illegal under federal law. Canada, as you guys recall, in mid-October, Canada became the second country in the world to allow recreational cannabis and a nationwide cannabis market. So cannabis is the most commonly used illegal substance worldwide, almost about 200 million people worldwide, and its use has been stated to be on the rise. Let's talk about the ways cannabis is used, and if you want to find out the ways cannabis is used, you just need to walk into one of our local pot shops. This is Lux Pot Shop, which is kind of a fancy-looking pot shop from the outside on Lake City Way, of all places, which is near where we live. There's 2 or 3 recreational cannabis stores on that street or on that in that area. And if you look in there, you'll see various different sodas, tinctures. I think these are looking like little candies. And then if you look, obviously to get very technical when it comes to the actual buds, looking at the THC amount, the CBD amount, what strain, etc. So it becomes very scientific, and they have this all laid out. And actually, when I walked in there, I took pictures, and of course I asked them, and they were very happy with me taking pictures in their store for whatever it's worth. So ways cannabis is used, one of them, as we know, is edibles. I didn't bring any samples, as we talked about earlier. That would have made this talk a lot more interesting. But you can see various products that can be used as edibles. And I mean, from a public health perspective, shortly after legalization of marijuana in Colorado, there was a spike in child emergency department visits. So we need to keep in mind, you leave your little gummies around, grandma or your 5-year-old might eat it, and that might not be a good situation. And it's fun to joke about it, but it can be a serious issue. I mean, people aren't used to that sort of feeling, and some people go to the ER, anxiety or some sort of mild psychosis if they eat too much. As far as inhalation, there are various methods, such as a blunt, which is essentially cannabis rolled in a cigar that is cut, removed of tobacco, and sealed. A bong, which some of us have seen, perhaps used at some point in college. Not myself, but this is combusted cannabis bubbled through through water, then resulting smoke is inhaled. Dabbing, which we'll talk about briefly. A G-pen, which we'll talk about. We'll talk about the vaporizer as well. And then there's a traditional pipe joint, which is cannabis rolled in a paper and smoked like a cigarette. And then hookah. A lot of people will actually get hookah, which is flavored tobacco over charcoal, and add some cannabis to that. And the smoking bubbles, like a bong, is inhaled. So these are things that we all need to be aware of, because the reality is our patients do use these things, which we'll talk about. So I had a patient who was actually on omalizumab, and I was looking at her FEV1, and it kept reducing. And I asked her, what's going on? How are you feeling? And she had been doing really well. She said, well, I'm not going to lie. I was using cannabis to sleep, but now I actually really enjoy it. I'm like, well, how do you use it? She says, I dab. I'm like, what is that? I had no idea what this was. This was a few years ago. So this is a method of using marijuana extracts called dabs, like shatter wax or BHO, like we discussed earlier, and it's pretty concentrated and it's becoming more popular. It takes a very high concentration of THC, so you get a really strong hit. You end up using like a blowtorch, and you heat up a piece, and then you use this metal utensil to place a small amount of that extract or shatter or wax or whatever it is on this hot nail, and then you inhale the vapors, giving you a very high concentration of THC. So it's something that we really need to be aware of. Invariably, some of our patients might use it. The other option of inhaling cannabis products are via a vaporizer. And the thought behind vaporizers is that it's supposed to be healthier. I think the data is still out on that, of course. And this was one of the few studies I could find, and this was actually back in 2007, where they looked at 20 frequent cannabis users who were then switched almost exclusively to vaporizing their cannabis for about a month. And they looked at self-reported symptom scores and spirometry measures, and over half had significant improvement in respiratory symptoms for what it's worth, and some modest improvement in lung function tests. And so the conclusions of this small test was that meaningful improvements in respiratory function could be found and via vaporizer, which might have use as a harm reduction technique in folks who have, either use it regularly or have to use it for medicinal purposes, etc. So as far as vaporizers go, you're essentially not burning the plant. You're not combusting it. That's where the problem is, most of it. And so if you get a good vaporizer, you pretty much just put parts of the oil or plant in there and then heat it up enough that it vaporizes the THC to a mist where you can inhale it. Some of these can be really expensive. This is the Volcano. There's little pens as well where you can put wax, oil, or even in some cases hash where you can vaporize it by an e-cigarette. E-cigarettes are becoming an issue, and, particularly among the youth. I think there was a report where it's becoming an all-time high, not necessarily with cannabis, but with nicotine. And the perceived benefits of an e-cig is that, as we discussed, it eliminates the suspected carcinogenic combustion products. But there are really no good studies, and the problem is a lot of these things are flavored, right? And so all the constituents in these products a lot of them might not be good to be inhaled. And so that could also be an issue. It could be very much of an irritant to the lungs. And the downside of these perceived benefits and the fact that some of these products might taste better, right? You might get like a 14 or 15-year-old who uses it. Maybe the thought is that this creates earlier age of onset, more positive initial experiences, perhaps more frequent use, and increasing the probability of problematic use or addiction in the future. So that's something that, from a public health perspective, folks are worried about. My interest was, in 2012, was how will this affect patient perceptions and patterns of use when we had legalized cannabis for recreational use in Washington State. And my thought was, how will it affect rates of allergy, perhaps? I've had teenagers particularly who would say, hey, marijuana is safe, it's natural. I had a teenager specifically ask, is weed good for my asthma? We'll actually talk about that and where that came from. But I was struck by that, and so that kind of became the interest of, to give a talk like this after legalization in our state. As far as popular opinion goes, a majority of folks are in favor of legalization of cannabis. When you look at this graph from 1969 through 2018, 62% now state that marijuana use should be legalized, particularly amongst millennials, Gen Xers, and baby boomers. And one of my interests, which kind of stems from some of the clinical research I did in fellowship, was, teens and adolescents with asthma. And then teens are prone to risk-taking behavior and that sort of thing, and actually chronic disease can be related to drug use, and even in asthma patients. And the perception of risk with the drug is important in this population, even in adults, where the perception of risk associated with using cannabis once or twice has decreased to about 15% as of 2014, which has decreased from 18.6% in 2007. So why is perception of risk important? Because there's clear data, at least based on this graph, that there's a inverse correlation between perception of risk and actual use of cannabis. So as the perception of risk goes down, use goes up. So you see a clear inverse relationship there. And it's an important thing to follow. As far as looking at perception of risk and legalization, there was one study that looked at the correlates of intention to use cannabis among high school seniors in the case of cannabis legalization. And this was in places where it hadn't been legalized yet, but they looked at data by monitoring the future survey for a 4 or 5 year period, and found that in the 6,000+ seniors who were surveyed, 10% of non-cannabis using students reported intent to initiate use of cannabis if legalized, and almost 20% of lifetime users reported an intent to use cannabis more often if it were legalized. And this study then thought, well, if it were legally available, the prevalence of cannabis use was expected to increase in this population. When we're looking at the National Youth Risk Behavior Survey, this was from 2017. This is a survey sent out every couple of years to high school students grade 9 through 12 throughout various states in the United States, looking at various behaviors, one of them being risk-taking behavior and drug use. So there's data on alcohol use, e-vape products, cigarettes, marijuana use, and looking at current use of these things, which is defined as on at least one day during the 30 days before the survey. Current alcohol use was about 30%, which is really interesting. You look at it, significantly reduced from 1991. Current cigarette use is almost a third of what it used to be. E-vape use is data that they've really just been gathering, so I don't have a lot of comparisons there. And current marijuana use is almost 20%, which is increased. That being said, it's been higher than 19%. I think a few years ago it was a little bit higher. In the mid-1990s, it was actually higher than 20%. But when you look at this, there's a clear contrast. There's a clear contrast between reduction in alcohol and cigarette use, and at least marijuana use has either remained steady or gone up. And 90% of marijuana is usually used by smoking in a joint, bong, pipe, or blunt. This is our own one of our own surveys from Washington State, and this is amongst 10th graders. And here you see marijuana use, which has actually remained steady. There was a little bit of a blip in 2010 and 2012, but really overall has remained steady despite the fact that we legalized marijuana in our state in 2012. Interestingly, you see kind of echoing what national data has shown, that cigarette use has really gone down over the past decade or so, and e-cigs were just started gathering that data as of 2014. So, based on this, we see that teenagers and adults, of course, use cannabis. So we really need to ask about that. And I think that was something, a simple thing that I had thought about, when we legalized this in our state. I saw more and more of my patients using it, but I'd only find out if I actually specifically asked them. I think now people are being a little bit more transparent with their cannabis use because it's legalized, and they know that it's no longer illegal in this state, so they feel more comfortable talking about it. But I think it's an important thing to ask. And so a few years ago, Andrea After and I, who was my mentor from the University of Pennsylvania, created a survey to all Quad AI members and asked various questions about interactions with their adolescent patients. And one of the questions were, what percentage of the time do you or your staff verbally ask your adolescent patients with asthma about alcohol and or substance abuse? And the majority of respondents stated that they do this less than 25% of the time. And as far as asking, and this is for adolescent patients particularly, how often do you dedicate at least part of the patient visit to interviewing your adolescent patients with asthma without a parent present in the room? And the vast majority said they rarely do this. Now, I'm also included in that. It's hard to do that each time. And I think a lot of respondents said, well, this is the job of the primary care provider or the pediatrician, which, I can see that perspective. However, if we're the folks treating these patients' asthma, if they're seeing us for asthma care, if you have an adult or particularly a teenager has a decreased FEV1, is not clinically doing well, particularly if it's an established patient, you need to be able to learn how to discuss this with the parent and the patient, where you end up having kind of a verbal contract with the parent and the patient, having the parent step out kindly, and parents are usually really responsive to this because there's clearly, I see it. There's some parents who answer questions for their kiddos, who are even though they're 15 years of age, and the parent is controlling the conversation. I think the parent sometimes feels a sense of relief when the child now is able to answer questions on their own, and it's really helping that child set up to more adult-centered care. And that's a problem in adolescence. You see these kids now who are having adult behaviors, but we still kind of treat them like children in a lot of ways. So I think it's an important practice to make sure that we interview our adolescent patients without a parent present, because you're going to be able to actually get clear answers about drug use, about adherence to their asthma medications, and it typically goes over quite well. And if you guys have questions about how to do that with your patients, let me know. But in the world of pediatric and adolescent medicine, it's actually very commonplace, and we're used to doing this. Why do this? Because even our patients with asthma do use cannabis and do smoke cigarettes. And this was from the National Youth Behavior Survey, I believe in 2003. Yes, and it was high school students with current asthma used things like cigars, cigarettes, marijuana, and inhalants at rates equal to or greater than high school students without current asthma. So we really need to ask these questions. So why should we care? For many reasons, but I think at least for the allergy care provider, there's various things that we need to keep in mind as far as, addiction strongly associated with initial marijuana use in early adolescence, addiction, altered brain development, poor educational outcomes, etc. But the question is, what are the short and long-term respiratory effects of cannabis? Is there cancer risk? Can you develop allergy to cannabis if you're using it early and more frequently? And these are some questions we'll be able to answer in the next few slides. So let's talk about the effects of cannabis, especially on the lungs. Cannabis, or THC, I should say, is kind of similar to the brain's natural chemical anandamide, and it acts on these THC acts on these cannabinoid receptors in the brain, and that's what essentially overactivates the endocannabinoid system, causing that high and other effects that people experience. THC can bind to CB1 receptors, which are primarily found in the nervous system, and CBN binds to CB2 receptors, which are found on some immune cells like ABL and macrophages. There's still, I think, people are trying to figure out exactly immunologically what's going on when someone uses cannabis and what receptors are involved, but this is what is known at this point. As far as THC goes, this is not our grandfathers or fathers' cannabis from the 1960s. This stuff is much more potent. When you look at the amount of THC, it was like 1 to 5% versus more recently at least 10 to 15%. Now, if you're dabbing and doing all these other things, which creates a very higher concentration of THC, then you're talking about a different sort of cannabis that was around a few decades ago. How does this potency have an impact on us clinically? No one really knows. I think that's not really well understood. But the thought is I've had a couple patients, 1 or 2 patients, who said they ended up in the ER after they had a brownie. They had no idea exactly how much THC was in there. They didn't buy it from a store that usually will say exactly what's the amount. And so if someone's making it home and it's homemade, you can end up in the ER with some sort of anxiety reaction or some sort of mild psychosis like we discussed. And could this potentially increase the risk of addiction, risk of allergy? THC is an allergen, which we'll discuss, but it's an interesting point to look into.
David, are there any real toxic effects of marijuana that can get you in trouble, or is it just psychoactive stuff?
I haven't heard, you guys can let me know, I haven't heard of any fatalities from overdose of cannabis.
So people end up in the hospital because they feel weird, but they're not really going to be hospitalized, put in an ICU and monitored.
No, not from my understanding. Yeah, now if you have horrible asthma and you're inhaling smoke, that might not be good for you. You could end up in the ICU because you have horrible asthma to begin with. But yeah, not from what I understand, it's not like, it is not to say that this is equivalent of, doing crack cocaine, right? Right, or heroin, right? So that being said, there is a risk for addiction, not very high, but contrary to common belief, there is a risk for addiction. And so if you're start using it earlier, let's say in adolescence, or people who use it regularly, you can also have some withdrawal symptoms if you stop smoking. And this is the whole thing. I mean, I'm not up here to kind of, proselytize that, cannabis is bad. I think it's one of those things where we just need to treat it as a drug. And I think there's a lot of folks who think that it's just this benign thing, that they'll just smoke every night. And we just need to be aware of what we're actually inhaling and be smart about it. I think on both sides, on the side of folks who are promoting cannabis, I think there's a lot of money to be had in this, right? And so we need to keep that in mind. If you look at, look who's funding a lot of these things that are pro-cannabis. I think Philip Morris is behind some of this stuff as well. So they're profiting from a lot of this stuff. I think they're being smart about that from a marketing perspective. So we just need to be careful and realize that cannabis is a drug. It contains various cannabinoids and different constituents. And it can have various effects, one of them being cardiovascular effects, which we need to be aware of. I think if you're smoking cannabis regularly, these effects could be blunted, but you could have a marked increase in heart rate, blood pressure, some occurrence of postural hypertension. Now, to answer your question, has anyone ended up in the emergency department from other causes? I think if somebody, let's say, has an existing cardiovascular issue and is due for an ischemic event, if they're smoking cannabis, you could have an increased risk of a heart attack after smoking it. So these are some things to just think about. As far as exercise performance, folks who smoke it might have decreased exercise test duration. It increases the heart rate at submaximal levels of exercise. Now, bronchodilation. Now, how is that word relevant? It's relevant because THC is a bronchodilator. Okay, so if you are, let's say, if you're inhaling it, let's say vaping it and not smoking it, some people say, hey, it actually makes my asthma feel a little bit better. And that's not a lie. That's actually true. So, but is it good for your asthma? No, I don't think so. Particularly if you're smoking it. Some people might get an immediate bronchodilation and then start coughing and then get bronchospasm again. And this is actually due to the THC content because that effect is not seen and if they take the THC out of the product. Patients with mild asthma, THC produced significant bronchodilation, which acutely reversed methacholine and exercise-induced bronchospasm. And Tashkin, Don Tashkin, has done a lot of work on this, and these are some interesting papers if you wanted to read them. The mechanism behind its bronchodilatory properties isn't fully understood, but it's thought to act on those CB1 receptors that we talked about, that eventually you end up getting reduction in bronchomotor tone. And so this was known in the 1800s, and that's why, the tincture of cannabis, and cannabis was actually thought of as a treatment for asthma. The question is, if you ingest this stuff, will it give the same amount of bronchodilation? No, not that I'm aware of, and I think it probably could have some effects, but certainly not as much as, like if you're ingesting albuterol, if you guys recall, at least when I was a resident in Cleveland, remember some kids would come in on oral albuterol, right, the drops, and they'd be bouncing off the walls because they'd have these side effects, but it really doesn't cause a lot of bronchodilation. It might a little bit, but nothing like it. What about we talked about cardiovascular effects, what about habitual smoking of marijuana on the lungs? I think this is going to be interesting. It's an interesting subject, I think, even moving forward. The next 20 years, and if they do some nice, well-designed studies, it'd be interesting to know what the effects of cannabis are on the lungs particularly. And the studies that are out there to date really have compared, marijuana with those of smoking tobacco. And it's a hard thing to compare because, when you're smoking tobacco, you might be smoking more often. You're not smoking 20 joints a day. You might be smoking 20 cigarettes a day, right? You might have a few joints a day. There's no filter on the joints, whereas there is a filter in cigarettes. So there's it's a hard thing to compare, and a lot of these studies also that have been done, a lot of patients will already be smoking tobacco and be smoking marijuana, so it's hard to really separate those all the time. When you smoke marijuana, your inhalation technique is very different. You're inhaling it deeper, holding your breath longer, and that actually might be responsible for a lot more tar and insoluble particulates being deposited in the lower respiratory tract. And could that cause more inflammation and epithelial injury? These are some questions that are out there still. as far as what's in tobacco and what's in cannabis, the reality is, yes, cannabis is natural, but if you're burning this stuff and inhaling it, there's carcinogens in there. All right, so there's very similar volatile constituents in cannabis and in marijuana. The biggest difference is, of course, there's nicotine in tobacco and there's THC in marijuana, and so both of these can have toxic effects on the respiratory tissue. And a few folks have sought to see what the effects are. Again, hard to separate marijuana versus tobacco smokers sometimes. But this Flegel and colleagues in the 1990s looked at airway histology of habitual smokers of cocaine, marijuana, and tobacco, and they did bronchoscopy and endobronchial biopsies. And both had significant bronchomucosal abnormalities, and the effects were actually additive, at least in this study, if you were smoking cannabis and smoking marijuana. And about 25% of young smokers, at least from a clinical standpoint, had some symptoms of chronic bronchitis, and a vast majority had evidence of cellular atypia and mucosal metaplasia in the major bronchi. A year later, Roth did a study looking at the early effects of marijuana and tobacco smoking on airway mucosa, and he used what's called the visual bronchitis index, which looked at 4 factors like edema, vascular proliferation, cellular infiltrates, and goblet cell hyperplasia. And they found that if you smoke marijuana or smoke tobacco, that both of those patient populations had visual evidence of central airway inflammation in the majority of subjects. All biopsies were abnormal, and they found mucosal erythema, and I would say the majority had 3/4 of the bronchial index criteria that were present. And when they looked at the bronchoalveolar lavage, IL-8 and neutrophil counts were elevated in both smokers of marijuana as well as tobacco, for what it's worth. As far as chronic respiratory symptoms, when you're smoking marijuana alone, there's some studies who are able to isolate that in patients who are not smoking cigarettes. And it's clearly been demonstrated that if you are smoking marijuana regularly, that you will have symptoms of chronic bronchitis, that you will have symptoms of chronic cough, sputum production, wheezing. And if you stop smoking marijuana, at least in some of these studies, that you can have resolution of those symptoms of chronic bronchitis. So, again, it's not fully benign, right? And so there is some inflammation that occurs in the airways when smoking this stuff regularly. What about COPD or lung cancer? That's something that can come up. If you're smoking tobacco, we know that's clearly a risk factor, but what about cannabis? At least when it comes to COPD and lung function, there's no good evidence to say that smoking marijuana, at least by itself, is associated or being a risk factor for COPD. And there might be some lung volume changes or modest increases in airway resistance, but it's really not fully significant at this point. And is there truly an additive effect that legal study found, at least histologically, between marijuana and tobacco? Clinically, we don't really know if you're smoking tobacco and marijuana together, is there an additive effect versus smoking one of them alone? We don't know that. And at this point, if you have someone who's smoking marijuana regularly, I would probably still check at PFTs, etc. Regularly, but there's no data out there to say that if you have a patient who's a marijuana-only smoker, that you have to do imaging or have to do PFTs regularly. Of course, if they have asthma, that's a whole different thing. What about cancer risk? I think the skinny on that is that, at least on this slide, is that there's no clear association with lung cancer or upper airway cancer. The studies that were consistent with risk of lung cancer were patients who were either very heavy marijuana smokers or mostly had concomitant tobacco use. The increased risk here, I think there was some of these studies there were still some missing things here that I think this one, the study, it was a small study overall, and so I think there's not good conclusions that can be made when it comes to lung cancer. As far as upper airway cancer, there's no clear association, and if there is an association, again, it might not be powered properly. So as far as cancer risk, there's some folks looking into THC, and it's interesting that in some cases it's found to have anti-tumor properties and maybe even tumor-promoting properties, and so that's still being studied. And as we discussed, THC, I think from our perspective, we think of it as could it be a potential allergen, and that has been shown to be fact that THC could be an allergen as well. So I think stay tuned. There's a lot still that is unknown about cannabis, and particularly about THC. There's a lot of reports. You guys may have gone by this at some point, where you have when you're drying cannabis, if you're not drying it properly, or if it's not in a well-ventilated area, you can get aspergillus on these plants. And if you inhale this, there have been case reports of ABPA and fungal issues in the lungs, particularly in immunocompromised patients. So you have to remember, some folks who are using cannabis, post-chemo and inhaling this stuff, we just have to be aware that should these patients vape it, or will that reduce the risk of developing, fungal products in the lungs? I don't really know. I think it's probably safer to vape versus burning it for various other reasons that we talked about. But there are various case reports of Penicillium species and Aspergillus potentially being contaminating marijuana plants and causing clinical issues, particularly in immunocompromised patients. We talked about alveolar macrophages. They actually have CB2 receptors on their cell surface, and regular marijuana smoking can impair the microbicidal function of those macrophages. And then if you're smoking marijuana regularly, you can get bronchial epithelial ciliary loss, which mechanically can make you prone to developing increased lower respiratory tract infection. But the clinical evidence here is largely case reports. We talked about the inhalation techniques of marijuana, taking a huge deep breath, holding your breath for a certain amount of time. And the thought is that inhalation technique, and can that contribute to these case reports of pulmonary barotrauma or bullous lung disease or pneumothoraces in the literature? And we don't really know, but it has been reported in the literature, particularly with patients who are smoking marijuana, so we need to keep an eye on that as well. So this is just a summary of what we talked about as far as marijuana and its effects on the lungs. Acutely causes bronchodilation. You can get, of course, bronchospasm and cough if you're inhaling the smoke. Regular and chronic use, we talked about, there's clear evidence that it can cause symptoms of chronic bronchitis, such as cough, sputum production, wheezing. There have been shown that develop patients who smoke marijuana regularly, you can see bronchomucosal abnormalities and inflammation. Could you see a reduced function of alveolar macrophages? And that's also been seen with regular or chronic use. And then there's questionable effects here as far as pulmonary function, bullous lung disease, as we talked about, risk of infection, COPD, which has not been shown to be a risk factor, and there's really an unclear risk of cancer. So switching gears, let's talk about allergy to cannabis. So this has been reported in various case reports. There's not a lot of good studies on this. I think that now with legalization in more and more states, you might see more people be more transparent about their use of cannabis. When we're asking them, or they might show up. We've had patients who say, "Hey, can you test me to this?" Whether it be an oil or the bud itself. I've had a couple of patients who are growers, so these patients might not be using cannabis, but when they rub up against the plant, they'll get itching and hives. And so this is something that we need to keep in mind. There's various cases of hypersensitivity reactions and even anaphylaxis, such as ingestion of tea or hemp seeds as well. That has been well described in the literature, at least in case reports. And you can get sensitization via multiple exposures, so the respiratory tract, cutaneous, or orally, as we discussed. Aside from allergic sensitization, there have been some reports, at least one report of hemp workers who were in a textile mill who developed bisonosis, which is a disease of the lungs brought on by breathing in these dust particles from the fibers. It might not be a true allergic sensitization, but if you're a lab worker or even folks in law enforcement who are exposed to this stuff and handling it regularly can actually develop sensitization, and that's been described. And this is just if you wanted to peruse PubMed, you'll see various case reports of patients having allergic reactions to not only hemp seed, but patients who are sensitized to tobacco and cannabis. Intravenous marijuana use was a very big systemic reaction. I don't know how they actually isolated it and gave it IV. Again, various other studies, not studies, but various other case reports, I should say. There have been a lot of studies looking at trying to find out what the actual allergens are in cannabis, and I think there's a list of potential allergens, and again, THC is one of them, but that's still being looked into. There's not a lot of, it's not set in stone exactly what allergens are in the plant. So, cannabis, it's a weed, and it does pollen. So if you're in India or Pakistan or even parts of southern United States, it can be a relevant aeroallergen. I think when it comes to growing the plant, again, I'm not a grower, and you guys can correct me if I'm wrong, but you're not going to get a ton of pollination because it depends on if they're male plants or female plants, right? So I think, I think they might keep the female plants more versus the male plants, but I think, at least if it's growing naturally in an environment, you will get, of course, both male and female plants, and you will get a good amount of pollination in the air, and it pollinates late summer to early autumn. And there was some studies looking at least there was one study in India looking at patients who were skin test positive to cannabis pollen, and these patients did have allergic rhinitis and asthma, but there wasn't a clear clinical correlation, between cannabis exposure and their symptoms. They were just happened to be skin test positive to cannabis. Same sort of study in Pakistan where they looked at 1,000 patients who were skin test positive to cannabis pollen, and these patients had other aeroallergen sensitivities as well. And again, there was no clear clinical correlation between the positive skin test results and their clinical symptoms. In Nebraska, they looked at about 130 patients in Omaha who had allergic rhinoconjunctivitis and/or asthma and had a positive skin test for cannabis. And in that subset of cannabis-sensitized patients, they reported respiratory symptoms during that cannabis pollination season, but they also had other allergic sensitization to other pollen, so it's hard to say if it was truly cannabis causing those symptoms. And there's a lot of cross-reactive allergens, as we mentioned in one of the first slides. It's related to hops. Cannabis is, and so there's some botanically similar plants to cannabis. There was a Belgian study looking at like an oral allergy syndrome or a cannabis plant food syndrome, where patients were actually allergic to cannabis, but when they would eat banana, tomato, or citrus, they would actually get oral itching with those foods. So if your primary allergen is cannabis, something that we need to think about in our patients with oral allergy syndrome if something's not fully jiving. But then again, a lot of these patients might also be sensitized to birch and grass. So it's hard to know, what's the actual original sensitization there. There's also some studies looking at tobacco sensitization, and could that be a risk factor for developing cannabis allergy? So this is something that we need to be aware of. I think we need to, again, ask about if you're having patients who have intermittent, hives or rashes that aren't fully explainable. I think obviously if you have, as we talked about, if you have asthma patients who aren't well controlled, we need to ask about cannabis and cannabis use. As far as testing goes, this is kind of an archaic way of doing it. At NAC, we'll essentially use this method here where we'll skin test to the extract brought in. So the patient brings in the bud, and then we'll have the staff macerate it with water, and then we skin test to that. If patients have questions about oils, they can bring in that oil specifically for testing. And again, this is not standardized, so there's clearly a lot of variability. there's not a lot of good studies to say, we've macerated buds and flowers in water, and we've tested, 5,000 patients, and this is the sensitivity and specificity of this test. Again, that data is not available. There is no commercially available test that I'm aware of at this point if you wanted to test specific IgE to cannabis. I think the legal limitations, at least in other states, could be a barrier to obtaining, preparing, and using extract for testing. So I think some final thoughts here. We need to ask about cannabis use. As I mentioned, clearly if you're smoking weed or cannabis regularly, it's not good for you and it's not harmless. We should really scrutinize. We scrutinize tobacco smoke. We ask, how long have you been smoking? How many packs per day have you been smoking? We need to do the same sort of thing with cannabis. We also need to ask, now that we're aware of all the smoking techniques or how patients use it, how do they use cannabis? Are they ingesting it? Are they dabbing? Are they using a bong? All of these things are really important to know because it has some impact on how we would approach these patients. And we should know that allergy to cannabis does exist and it should be considered in the proper clinical scenario. And I think that's it. Questions?
Dr. David.
Yes.
So you mentioned about marijuana use and asthma. However, you didn't show us any data to look into how marijuana affects asthma outcome.
Yeah, I don't think we have any data on. So the question is how marijuana affects asthma outcomes, and it's a good data on that. And I didn't come over any study that looked at specifically, especially marijuana-only smokers and asthma. But if anyone has seen anything like that, let me know. I did come across anything.
Have you come across any information that marijuana used in people with mental illness, like CBD or hypomania or borderline personality, positive effects or even negative effects?
I didn't come across that, but that doesn't mean that it doesn't exist. Yeah, I was mainly looking at respiratory effects. Yeah, but I didn't come across that. Yeah, we know that there's at least other side effects. Someone had mentioned, I gave this talk at another conference, and someone had mentioned, we see hyperemesis with marijuana smoke. So it's something to keep in mind where patients will say, actually, that one patient that I mentioned had a brownie. She said she thought she had an asthma attack immediately, but her husband said, "No, you were fine breathing. I think you were just panicking." And she actually ended up throwing up several times. I think an hour and a half later or so. So she had an episode, I think, of hyperemesis. I don't think she had an allergic sensitization to it. She had no itching, no other reactions. Of course, I said, if you want, we could bring it in and we could skin test to the product that you ate. But I think that episode was more of a hyperemesis reaction plus anxiety versus a true systemic reaction or IgE-mediated reaction. Interesting stuff, right, to think about. And I think, any other questions?
Donald Tashkin was one of the guys who
right.
published early on. He hasn't done anything since '93.
No, that was all the way to 2013, I think.
2013, but nothing since then.
He's written some opinion art. I don't think he's done a
But
lot
no
of
more studies.
Not that I saw. At least ones that chose to use anyway. But he's done a lot of. I've seen some papers from him since then, but I don't think they were schizophrenia or studies that he's done in the past.
Does THC still have the record for getting into the brain faster than any other chemical?
Good question. I didn't know that. So the question is, does THC have a record for getting into the brain faster than any other chemical?
I think I read a statistic
Is
that
that
gets
what
into
it
the
is?
brain faster
Yeah.
than any chemical.
No
Yeah, it's
kidding.
THC.
Yeah.
There's obviously some special receptors that just let it go right through.
I mean, and the fact that it's if you look at a bud now and smoke it, the amount of THC that's in there is significantly higher.
Do the female plants have is there a selective difference between the amount of THC in a female plant
I don't
versus a
know
male
that.
plant?
Yeah, female versus male plants and the amount of THC, I don't know.
Do you have to grow both in order to grow them, or
Yeah, I think so. I mean, I think because they have to.
I'm looking for a second career.
Yeah, exactly. Yeah. What time is it? I think yeah, so I whipped up the 2/3 of this. I actually hadn't seen a lot of these slides for quite a while. The first, part of the talk I just gave, a few weeks ago, but the second half, to kind of sub in for the other folks that I talked
So
about.
it's interesting over the last couple of years that some of the major alcohol companies, in other words, Constellation and InBev, are investing heavily
Yeah, there's
in the
a lot
marijuana
of
industry. And I don't know how much of it is like this, seeing alcohol use, decrease a little bit, like it's,
right.
what we can't lose sort of if we cover both sides of it.
I
Any
think,
of the pharmaceutical companies interested in
I think also, even though the marijuana is legal in Canada
looking
and
for a
Washington, I think this is a felony to transport marijuana across the border.
You can't just put marijuana in your pocket and go across the border.
It's a felony. It's not even a minor. It's not a minor infraction. So
They'll take it from you, but if it's a large amount.
I know.
they'll arrest you.
That's right.
The amount of tax money that the state gets from this is phenomenal. It's like hundreds of millions of dollars.
Yeah, I think the problem is, legalization came on too early, right? Legalization, but now you don't know, how do you know if someone's intoxicated? What level is that, right? And so, now everyone's trying to
Technically, our headquarters is in Israel. I don't know.
Well, they have breathalyzers for alcohol, but is there a way they can test
no,
it?
looking into it, from my understanding, the problem is,
Just
neighbors around you.
I know. That's very suspicious.
So the legality goes, the
I wouldn't be
impaired
surprised
right.
that you would just.
Right.
So it doesn't make any difference what you take.
We all work.
If it's
Another extract
What's the
without
cutoff
the
level,
shells
right?
and other stuff, so that's the only reason I know.
So I guess for it. No, that's measuring the presence of the alcohol. It's an impaired driver.
Yeah, I don't know.
Can you touch your hand and walk a straight line? Reflexes.
Yeah, so they'll look to see if you're impaired, but the question is what's
Yeah, that's a different question, but if you're impaired, you shouldn't be driving.
Yeah, likewise.
But if you did a blood test or a urine test, it might be in your system for a week. Change your license.
Bronchodilator, any sense of how long that bronchodilation affects?
I tried it out. I don't remember what. In the 60s.
Yeah, I don't think it's I think it's
As in your slide, it said 1 to 2 hours.
it's a few hours.
I don't never forget.
The question is if you did. Healing it, I think it's just a few hours.
Yeah.
Interesting.
Oh, you're kidding? Yeah, so they both got ABPA because of that. You get aspergillus on some of this.
Do you have gun will travel?
Go what?
Do you have gun will travel? So do you get sick?
I have.
To where?
It's like we just did. Once the Nurses Association did the one that they do in Bend, Oregon.
The primary care.
Interviewed one guy that
Pediatric folks.
another guy coming
I haven't specific.
Would you be interested in mental health?
No, it's just that long.
Yeah, I mean, do you have any sponsorship by anybody?
My only sponsorship, I've done like talks for folks, Spiriva.
so far.
What do they mean?
Spiriva, the
Inhaler.
inhaler, yeah.
Okay. So,
That's my only.
I would really be eager to get you to talk to especially the ones that deal with drug use.
Yeah.
They told this is a mental health imperative.
Okay.
Very high. So this may either be helpful or hindrance.
Yeah, well, and I can, we know, and I think it's been always looked at from a perspective of my perspective. Right? What does it mean? From a mental health perspective,
Yeah, but you could.
my interest was always
Yeah, but you also asking the parents to leave their home and really getting the information. Very good. Really
I don't know, hopefully, I kind of stumbled through part of it because I haven't seen the slides for a while.
Yeah. I'm going to try to hook you up.
Yeah, let me know.
We must have David.
Yeah, hey, thanks.
We must live in the same neighborhood. I live over in Meadowbrook.
Oh, yeah, I'm not, yeah, I'm not.
We have to drive down Lake City, get the strip joints and the hot joints.
You at the door? Whenever people come visit, I
I know.
I live on Orange Avenue. But it's, yeah, there's that. Remember the urban elements, you see that one, they have to cover up their sign.
Yeah.
Because it had a big, because you're not supposed to do that now, and have a not symbol. Because I think it's recognizable.
Because you were in.
Or you can have the Green Cross, but you can't have the.
Dr. Haney, before you call, I work with Leonard Jab on industry side to make sure breakfast show up. But I'm your rep for HU.
Oh, cool.
You actually, several years ago, you would not want to work with me for the degree of you diagnosed me with my allergies.
Oh, good. All right.
Apparently every day has
Yeah.
like I had moved. So let's say I had moved here, I'd moved here, and been here for 2 years, and all of a sudden I was but we were.
No, I'm from Ireland, but I.
Yeah. Yeah, what was it like? Oh, no.
Yeah, about that.
Hope that helps.
Yes, it did know what you did. Like, absolutely. Oh, sorry. Thank you so much, by the way, for today's talk. It was fascinating.
No.
Yeah, I just was going to teach you. Like I said, I wasn't.
Between the ciders.
I'm like, dude.
Yeah.
I think you're just like you.
I didn't know that.
I'm like,
Oh, yes.
I'm a third of it. I'm like,
It seems to be a lot of intense rivalries with some too. So I want to kind of bring a handful of focus with the audience.
I'm from
Yeah.
oh, okay.
and I moved here. I think right at the top of my
Yeah.
Do you want some food to take with you?
No, well, you know what?
I'm taking it up to the windows.
That's going to give you heartburn. I'll take a
Sugary thing?
I'll take a food cup. Thanks, guys.
Okay.
I joked with Todd that
She's going to
to Washington
Okay.
the year that it got recreationally legal.
Ireland or South Africa.
It's really
how that pairing developed.
well, I think the year that I moved there, I got 2 Christmas cards, the same Christmas card from 2 separate individuals.
This is just a few weeks because she's in high school. So.
And one correlated cookies in a house and a Christmas tree. And Santa, whatever you do, don't. The cookies or the brownies, we're watching. And then I got it from 2 separate people because they all joked that, like,
Is she going soon or
And it is. I mean, it.
Let's see, it's January.
Okay. That'll be cool.
Yeah.
I mean, it'll be like here. I just want to throw this stuff up at your podium is all. Thank you. Yeah, well, it's very soon. I thought we were in Australia, but I thought it was
Yeah. Yeah.
He's doing, he's doing a talk for patients.
Yeah.
I learned a lot.
Yeah.
Baffled by my application.
Yeah,
Yeah, never heard of it.
oh my gosh, that was fascinating. I was like, oh, that's so scary.
Look it up.
Yeah.
But he's doing a patient talk, so if you have been a patient center,
I am
What's he doing?
next Monday, up in Everett. So he's doing conversation for patients specifically. Yeah,
You mean fill it with it?
yeah.
Have a good day.
Thanks.
You want some? Do you want to take a couple fruit cups or anything with you? Do it.
Yeah, the boy might want some. And here's a cinnamon roll in there. I'll take 2.
Good for you. It's a good excuse to try to get in front of. Unfortunately, so I don't know how your business works, but like Megan essentially is the ruler of like my business.
Wait,
So my essentially 90% of my business all comes out of Northwest Asthma and Allergy.
Oh, wow.
80% is just they use it. So go ahead and toss it in there. I always put it in the cafeteria for them. So essentially 80% of my business is document development, so which is why I'm so involved in this.
Yeah.
Forget your parking.
No. It was. I didn't bring a cheap pen, so I put my pencil down.
Oh no! Somebody grabbed it.
Somebody-
Well, you were jotting names down right at the end there. weren't
Yeah,
you?
but it wasn't my pen, so and I just realized I put it down. Oh wait. Okay, I have it. Never mind.
I love your shoes.
Oh, thank you. Hold on.